Okay, a common question about DPC is how many patients do you actually see like on a daily, weekly basis? Because in the fee-for-service world, it's like, well, how many can you see? You're seeing 20, 30, 40 plus patients per day. And I'm going to switch to DPC because I don't want to stay at that pace. I want to be able to have more time for my patients, more time for myself, not just constantly feel like I'm running from room to room to room and catching up on charts and all those sorts of things, but what does that actually equate to? And I've been in a DPC practice as a pediatrician for the past 2 years and also had a lot of experience talking with others and in the DPC Facebook groups and everything like that. And there's a pretty good rule of thumb that about each week you will see about 1% of your patient panel over the course of the week. And so my pediatric practice, we have about 550 patients. And so this week we've seen 46. The week before we saw 58, which is right around there in terms of the 1% of your panel per week. Now we see patients from 8:30 to 4, and we're able to get everybody in. So it's not an issue of like the pace is too much or anything along those lines, because we don't send people to urgent care. We don't make them wait days and days to get in. We're able to accommodate them, and we're able to add on. If somebody needed stitches, they know just to text, and if it's during business hours, they can just come on over. If somebody texts at 1 o'clock or 3 o'clock that has a fever, we can say, hey, do you just want to come over real quick? We'll get you seen before the end of the day, or would you rather come in the morning? It makes it easy to practice that way because you don't have this huge, overwhelming schedule that you're competing against and trying to just squeeze people in all the time. You have the time and the space to make all of that work. Now, the other part of that is text messaging. So we do a lot of texting. Parents prefer that. We prefer that because honestly, it saves from phone calls and voicemails and all those sorts of things. A lot of time it's stuff that we can reassure, we can talk through, we can get them the information that we need, we can make the connections, whatever it might be, over text message. And that equates with about 1 to 2% of our patient panel texts each day. And so we have 550 patients, so that's about 10 different families that are texting on a day-to-day basis. Usually it's like minor issues or rashes, or can you look at my kid's poop, their diaper or something like that? Is this normal? Things along those lines. Or can you send in this prescription, or can you send immunization records to school? Something along those lines. Not a lot of them are very complicated or multi-text back and forth. It's usually question, answer, thank you. We move on from that. And so it doesn't take that much time if you're thinking, well, 10 patients texting in a day seems like a lot. It doesn't actually equate to that much time. And so that's the basic rule of thumb. So as you're planning your practice, you can kind of gauge, okay, here's what I'm going to do when it comes to my availability. Here's what I'm going to expect when it comes to my patient volumes. Based on that is about the 1% rule. The other nice thing is, even if you're saying my clinic is open from 8 o'clock to 4 or 8 o'clock to 5 or whatever it is, that doesn't mean you have to have all of it open for patients. I have several half days off per week where, yes, our clinic is open. Yes, my nurse is here to answer your questions, but I'm not here. And if I needed to come in and see somebody on the quick, I certainly could, but I'm at home or I'm doing something else or I'm out. That is very possible in the DPC practice, especially when you let patients make their own appointments, because they'll just find a spot that works for them on their schedule and then plug it in. And if they can't, then they know, just text us and we'll get them in when they need to be seen. Keep up the good work.